aware. You'll be able to see it on our Facebook page posted, as well as our YouTube page. We'll be posting it there once we're done. But for those that don't know, the Walk to End Epilepsy is a nationwide event series that brings together local communities to raise awareness and funds for epilepsy. This event is one of 22 scheduled spring walks nationwide, and because of COVID-19, with your safety in mind, we have made all of these virtual event. We have scrambled to change all of our processes right now, and we hope you're enjoying this and connecting with us. I will tell you, for those that were going to come out to DC, it's raining. So at least we don't have any rain. We'll take the silver lining wherever we can get it these days. It's those little moments that count. So I want to thank you for spending a little bit of time with us this morning. The Epilepsy Foundation, we're a nationwide organization. While we're headquartered here in DC, we actually serve the entire country and have field offices throughout the United States. And we're so glad that you could be with us virtually. And I just want to ask, who is actually planning to walk with us today? And how are you going to do that? If you want to use the chat box on the right, maybe throw in a couple of unique things that you could see. We want to test out our chat function. We have teams monitoring chat as we go. I'm going to pull it up here too and take a look. Treadmills, nice, I love that. People are going to go out, get maybe a walk around the neighborhood. That's good. Nice little social distancing walk. Good morning from Sterling, Virginia. Rick from Sterling, Virginia. I'm probably 1.5 miles away from you, to be honest. This is great. We're outside. People are going to walk the dog up and down the stairs, hiking. Hello from Atlanta. I see Chicago, Southern California, Cincinnati. We've got Grand Rapids, Michigan. We've got people everywhere. We've got family members, kids, dogs in here. I'm seeing a whole breadth of things. So I just want to say thanks for joining us today. We want to encourage you to wear purple over the next 30 days. When you do walk, take pictures and use our hashtags to share with us and our sponsors, Virtual Walk to End Epilepsy and hashtag Walk to End Epilepsy on all of our social media platforms. We want to stay in touch with you and want to see how you're doing and how you're raising that awareness and supporting us in the work that we do to support you. We will announce the winners. We have an iPad winner at the end of the call, so stay with us. And before we get any further, I do want to introduce our CEO, Laura Thrall. Laura has started this past Monday as our national CEO. If anyone can imagine what that is like, I mean, unbelievable time to start a new organization. But we are so thrilled with her exceptional experience leading nonprofits. She is bringing some real energy into our community and taking us into the future at a time where, frankly, we are really grateful to have her leadership here. So I want to turn it over to you, Laura, and thank you.
Well, thank you, Jeff. It's so nice to meet everyone, even though it's just virtual. I'm sorry that we're not all in the mall today. As Jeff mentioned, it's a rainy, gloomy day here in DC. So, you know, I'm hoping later this afternoon it might get sunny and I'll go out for my walk. Otherwise, I'll be hitting the treadmill with the rest of you guys. But overall, I'm so excited to be here, even though it's a crazy time. As Jeff mentioned, I've got about 30 plus years of experience leading nonprofit organizations. This is actually my 4th CEO role, and frankly, it's the one that I am most excited about. I think we have a wonderful opportunity to be even more efficient and effective for the people that we serve, using, you know, these generous donor dollars that all of you give to us as effectively as possible to serve the community. You know, certainly we can't do this. You know, we can't serve the 3.4 million Americans impacted by epilepsy without all of you. So despite the crazy COVID-19 crisis that we're all living through right now, I truly appreciate all of you for coming out today, continuing to fundraise, because for people impacted by epilepsy, COVID-19 does not stop the fact that they need us every day. So I'm especially grateful to everyone to really make this happen, even under these bizarre circumstances. I want to give a big shout out to all of our sponsors We realized that a virtual walk wasn't necessarily what you thought you were going to be sponsoring, and we are also so grateful to you for sticking with us in this difficult time. It's so important that we all do this together. So as Jeff mentioned, we're all going to try and get out and walk today somehow. Even though we can't be on the mall, I'm going to be walking through my neighborhood, or at the worst, I'll be upstairs on my treadmill in the gym. So thank you again all for being here. I'm really excited to work with you throughout the years as we all try and impact people with epilepsy. And hopefully I'll actually get to meet you in person at some point instead of sitting here in my office.
All right, thank you, Laura. We are thrilled to have you. And like you said, we're gonna walk in any different way. And I mean, you may just want to walk, across your room. You may be going down the steps, right? Taking an elevator is not going to have the same effect, but if that's what you want to do, that's fine. So I'd like to take a second and bring in one of our national sponsors, Greenwich Biosciences. And we have to get creative since I'm in my basement. I'm not allowed to see anybody. I don't know if you can see that or if it's backwards, but we have Christy Klein from Greenwich Biosciences. And I want to introduce her because she leads advocacy relations for Greenwich. We want to give a big round of applause to her because not only are they providing great service from the pharmaceutical standpoint and leading the way with the CBD oil, FDA-approved CBD oil, but they're really playing a pretty strong role in the advocacy market. So can we unmute everybody? Let's give this a try. And a round of applause. Let's see what that sounds like.
Epilepsy.
Pull you up here, and I'd love for you to
Hi, Jeff. Thank you. My name is Christy Klein, and I'm honored to be speaking to you virtually today on behalf of Greenwich Biosciences and our entire team, many of which are joining this call as well. As a nationwide presenting sponsor, we are so proud to partner with the Epilepsy Foundation and its affiliates for events like this all across the country. We are united in what we're trying to accomplish here today to raise epilepsy awareness, have a positive effect on care, on research, and on the lives of those who are impacted by seizures. There are so many families who wake up every day to the reality of epilepsy. There are people listening to this right now who've been fighting against it their entire lives. But as a community, we never give up hope that one day we will overcome the challenges of living with epilepsy. This is what drives us. You may know us best as the company researching and delivering FDA-approved cannabinoid medicines to help address serious conditions. But also know that our focus is on you. Patients and families are at the center of everything that we do, and we strive to make a positive and meaningful difference in their lives and in your life. We're all hoping that we could have been together in DC today as planned, but it's so wonderful to see the community coming together, even during uncertainty in times like this, when it's so essential that we stay physically apart. Don't worry, next year we'll be back together, stronger than ever. And I hope that you and your families have a wonderful experience today. And I can't wait to see all the photos that you share. Have a great virtual walk. Thanks, Jeff.
All right, thanks, Christy. I really appreciate it. Thank you to all the work that you and your team are doing, to Greenwich. You've been such great supporters of the Epilepsy Foundation, so we really can't thank you enough. And we are going to try to maybe mute everybody here for again and clear the ranks here just so we can hear it. So thank you for that. I have a special guest here for you. I was able to twist his arm and get him to join us because this is a really special time as well this year. If you could put the pandemic aside for just a moment, we want to celebrate the fact that this is the 30th anniversary of the Americans with Disabilities Act. And my special gift to you guys is Tony Coelho. Not only is he a national board member for the Epilepsy Foundation, but he was one of the primary sponsors of the American with Disabilities Act back when it was first launched. And then he continued to make sure that stayed current and made upgrades to it to make sure it included everybody. And I've asked him to come on to give a little bit of background. He was the congressman from the 15th district in California, and he's still serving all of us in our community today, and we can't thank him enough. So Tony, come on board and just, can you give us a little sense about why this walk is important, why you're involved with the Epilepsy Foundation, and what the heck, why did you do this whole ADA thing to begin with?
Thank you, Jeff. Thank you for being on, and I'm so happy to be part of this whole virtual walk on epilepsy. We started the Epilepsy Walk 14 years ago, and that was to make sure that the lawmakers in Washington, D.C. understood what epilepsy is all about. We have to educate and so forth. So give an opportunity for all of you from all over the country to come back to Washington and help us educate members of Congress as to why we need their help, why we're important, and so forth. And it's really worked. As Jeff has pointed out, the ADA was adopted 30 years ago. The Epilepsy Foundation led an effort on that. We were very, very involved and engaged, and I was happy to be part of that. The Supreme Court ruled that epilepsy was not part of the ADA, and so we had to go back and do the ADA Amendments Act to make sure that those of us with epilepsy were included under the ADA. We did that successfully. Again, the Epilepsy Foundation led the effort for the ADA Amendments Act. So all that is part of what I feel so strongly about when we started the walk, is to make sure that your elected officials from all over the country understand what we're about and why. You might ask, why am I so interested? Well, I have epilepsy. I've had seizures since I was 16. I'm now 78. So I still have seizures. I still understand the need for us to be involved and engaged in part of this whole effort, and the real importance for us to educate, for us to be proud of who we are and stand up for what we believe. That's what it's all about. I have not lost my fire in regards to representing those of us with epilepsy. I think it's critically important that people understand that we want to be involved, we want to be part of it, and we will help make a difference. So thank you all for being on this call today and part of this virtual walk. And hopefully next year we'll see you in Washington, D.C., so we can continue our process of educating our elected officials. Thank you, Jeff, very much.
Well, thank you, Tony.
Thanks, Tony.
I really appreciate you joining us today, and I appreciate all of the work that you've been doing for us over the past year. So I think one of the things I'd like to turn to now is our first mission moment. This is with Erica Cottenmeyer, and one of the reasons we're walking today is really based on a great example here in her story. She's the captain of Team Ben and Erica. Erica has raised over $1,700 so far. She is really a tremendous supporter of us throughout the year. We'd love to hear, Erica, why you are involved in the Walk to End Epilepsy and your story. Do you mind sharing that for us? We'll work on getting Erica on. Let's see. All right. We're gonna come back to Yep. All right. We're gonna come back to Erica in a minute here, and we'll figure out what's happening on the technical side and get back to her. But we want to also talk about recognizing our champion support level. We have. Is this Erica here? Is that Erica? All right. We'll come back to it. We want to thank our champion support level. We cannot do any of this without you and without our partners, our corporate partners. So, oh, I lost, there we go. So first I want to thank our champion level sponsor, LivaNova. LivaNova keeps you safe. And, you know, again, we don't have everything that we need here in the basement of my house, but just like this hand sanitizer, you know, where you should wash your hands, LivaNova keeps you healthy and safe. So I want to say thank you to LivaNova for your commitment across the board, and for all of the great work that you're doing in the epilepsy community. So we want to give a quick shout out to LivaNova. Thank you. And as we're transitioning here, the other thing I wanted to talk about is fundraising and the recognition that we are fundraising for mission. That we would not even be here today if it wasn't for the work that we are doing across the country and in partnership with our community. And some of the things have really taken on a critical role in these past few weeks with COVID-19. So the funding that we are raising for this walk supports mission. It supports the work we're doing in communities across the country. One of the things that we have, you may be aware of, is our 24/7 helpline, right? That has been ringing off the hook. People are asking for information. They're worried. They have questions about employment. They have questions about legal status, insurance, access to care. That all gets funneled through our 24/7 helpline. And as you can imagine, that's been really bumping these past few weeks. We are also continuing with seizure first aid and recognition training, right? We're talking to teachers who are at home and doing virtual trainings across the country so that we can make sure that people identify what all the different types of seizures are that are out there, and then be able to know what to do, stay safe side. We want to make sure that people understand that there's very simple but very critical steps that you need to do to help someone with epilepsy. We're running virtual support groups around the country to help people through this difficult time. Our advocacy team is making sure that our community has access to telemedicine visits, that insurers are actually covering the cost of those, that we can get more larger quantities of our medication, so you don't have to keep going back out to the pharmaceutical to the pharmacy. These are things that are directly impacting our community right now. And by the way, research doesn't stop throughout all of this. So we are continuing to fund and manage our research projects to make sure we can bring new therapies to the market in a time frame that matters as fast as safely as possible. So your fundraising goes directly into these mission areas, and I personally just cannot thank you enough for that support. And I'd like to take a moment and recognize some of our top fundraising teams for this walk. And in third place, we have Team UCB, also a wonderful sponsor of ours. So thank you, UCB, also for keeping us, that's strong, for also keeping us safe and raising over $7,000. Their team captain is Alexandria Giles, and you'll be receiving a party to celebrate with your team. We're so thankful for everything we're doing. Can we make some noise for the third largest fundraising team so far?
Yeah.
How do you probably know? All right, thank you. In second place, we've got Team Super T, who has raised over $9,300. Their team captain is Courtney Watson. You'll be receiving a $20 credit for each of your team members on epilepsy.com to get excellent purple gear like this. So let's give a huge shout out to Team Super T and Courtney Watson for everything that you guys are doing. Congratulations. Now, in first place, without further ado, raising over $39,000 this year for the organization is Team Katie, and I have their team captain Harry Johnson. Can we give them a huge round of applause? $39,000 and counting. We cannot thank you enough, and I think I have Harry Johnson, who is their team captain, on the line here. And if I can pull Harry up, I just wanted to turn this over to him for a minute and ask him that, why are you doing this? Why are you supporting this walk and the Epilepsy Foundation, and why is this meaningful to you?
Can you hear me?
Oh, we hear you. Hi, Harry.
Oh, well, hello to everybody. Our team really is for our daughter, Katie Hope Johnson, who had epilepsy and unfortunately had a seizure that she didn't recover from. And we walked to honor her life and the things that she accomplished during her life. really to try to help other families not have to go through the things that we did, and to try to help advance treatments, family support, and really to advance research in how to treat this horrible disease. And that's really why we're doing this. We hope to continue this, and my heart goes out to everybody involved with the Epilepsy Foundation and people with epilepsy that live with it every day. And that's really what it's all about.
Great. Well, Harry, thank you so much for sharing that. I am so sorry and so thankful for everything that you and your family are doing, and whatever we can do to continue to help, we will. But I'm really grateful for all the support you've been providing over the years. So thank you so much. I want to turn it back over. I think we have Erica. Yes, I think we have Erica Kottenmeyer back here, and I'd like to pull her up as well as one of our lead individual members, as well as somebody who really connected with us and said, "I'd love to share my story with you." So, Erica, let me turn it over to you and ask you the same question. Why do you walk, and what's driving you? Oh, we're so close. Oh, Erica, we're so close.
Erica, you may be
I
on
have
mute.
you visually. Don't think so. All right, we're gonna, Erica, we're gonna try. We'll get back to you. We're gonna try one more time, and I will promise if we can't get you, Erica, on this, I'll do an interview with you afterwards that we'll send out as a YouTube clip to everybody to make sure that we get your story shared throughout. So we'll come back to that. So a little housekeeping for everybody. If you've raised $50 or you will raise $50 through May 18th, each participant will receive an official Walk to End Epilepsy shirt. So just because we're not out there doesn't mean the shirts have gone away. We've got a great design. We are ready and raring to go with getting the shirts out the door. So our teams will be mailing this out. Be patient. Things take a little longer. I'm sure, I think there's one or two of our team members that have a lot of boxes somewhere in their garage, but we want to make sure that you're aware that if you do raise over $50, you will be getting that shirt, and it'll be coming to you, and we'll work with team captains on that. And there is still time to participate. To use your participant center to fundraise, send emails, connect with your Facebook account. Our walk pages all have a direct link to Facebook. You can start a Facebook fundraiser and push something out that way. Very easy to do. A great way to get support from your network, and share your story, personalizing your page, using it to really garner that support. So how are we going to do this virtually, right? So we're not here today. You might go do something today. Maybe it's a little rainy. You want to do it in the next week or two. Well, there's three things. We want you to, one, share your story and drive awareness in your community. Two, we want you to walk. Just go out and walk. Hop off of this call. While you're doing it, take a picture of yourself, maybe a fun challenge with your family, maybe a short video, but go out there or up there or down there and go for a walk, take a picture and tag us, and ask your network for support, right? Sometimes a very simple email with a link or a social media post to your friends, your family, your colleagues, can really make a difference. And I completely understand these are incredibly difficult times right now for our country. We understand if there are challenges to giving. We are trying to continue, as I mentioned before, all of the programs and services that we're delivering in a very difficult time. So we are trying to continue to make sure that those services continue unabated. But just know that every little bit helps, right? It doesn't matter if it's $1 or $100. We are looking forward to that support in some way if you can. So We've also built, I want to transition here for a moment, and we look forward to trying to reflect on different parts of our community. We have a very robust, but a very diverse community. And I think one of the areas that I think has really strengthened over the years is our partnership with the Danny Did Foundation. We've built a space on Facebook to honor those that we've lost along the way. And we want to remember and honor and celebrate those loved ones. And we'd like to take first just a moment of silence to remember all of those that are lost. So join me in that moment of silence right now. Thank you. It's never easy to lose a loved one, and we do have the SUDEP Institute, which is run by Sally Schaefer at the Epilepsy Foundation. I encourage anybody that has questions or who has been impacted by SUDEP to reach out to Sally. We'll make sure we share her information. We have bereavement services at our organization, as well as, again, education out there in the community to understand what it is. You may have seen our partnership with the Cameron Boyce Foundation. Cameron Boyce was a Disney actor who unfortunately passed away in 2019 from SUDEP. We've started the No SUDEP Now campaign with the Boyce Foundation. So if you're interested, please check that out, nosudepnow.org. And we want to thank everybody for their support on this really, really difficult topic. And Sally, in fact, Sally, yeah, if you want to put, Sally, your contact information, the best way to reach you in the comments, that would be great as well. I want to turn to advocacy. We're in Washington. We were in Washington, D.C. So I want to make sure that we're touching on advocacy and the work that we're doing behind the scenes to make sure all the things happen smoothly in the world of epilepsy and epilepsy support. So I want to turn it over to Laura Widener, who's our Vice President of Advocacy, who's going to chat a little bit more about the highlights that the team has been working on this year and their successes. So Laura, take it away.
Good morning, everyone. So nice to see so many faces, even virtually from across the country. So advocacy is all about raising your voice and sharing your story to achieve positive changes. In the last year, the foundation, along with our amazing local epilepsy foundations across the country and our tenacious grassroots advocates, have been successful in many areas, including a few that you see here on the slide. We have passed seizure-safe schools legislation in 4 additional states. It's a bill that helps raise awareness about education and seizure recognition and first aid in schools, and helps make sure that students can access the treatments that they need. We preserved Medicare's 6 protected classes policy, which makes sure that Medicare beneficiaries can access needed anti-seizure medications. And we secured a $1 million increase for the epilepsy program at the Centers for Disease Control and Prevention. And on the next slide, obviously through the COVID-19 pandemic, our community is facing even more challenges. And since advocacy is all about solving problems, we've been hard at work and have already helped ensure that Medicare beneficiaries can have up to a 90-day supply of their medications through the pandemic, that states deem medical cannabis dispensaries essential and provide access to needed treatments in line with social distancing guidelines. We've been working and have helped make sure that people with disabilities aren't denied care solely because of their underlying medical condition. Also that Medicaid programs have adequate funding to serve lower income people with disabilities, and that paid sick days and paid leave are expanded, though we need this expanded even more. So on the next slide, there's much, we've achieved much, but there's much more to be done, both through the COVID-19 pandemic and beyond, and we can't do it without you. We need your voice and your story. The foundation brings amazing teenagers living with epilepsy and their parents to Washington, D.C. every spring to learn how to be advocates and meet with their members of Congress. We actually just did that in early March here in DC before COVID really started taking shape across the country. And you can see some of our amazing teams here on this slide. But we need more people sharing their stories with their elected officials to continue raising awareness about epilepsy and the needs of our community. So we urge you to join our Speak Up, Speak Out network today. By doing this, you'll get updates about our advocacy work at the federal level and in your own state, and opportunities to connect with your elected officials about important policies. The link to join our Speak Up, Speak Out network is here on the slide. And again, we just want to say thank you to all of you who are advocates already. We urge you to join us. And the advocacy team is delighted to participate in the walk today.
All right, thank you, Laura. Really appreciate all the work that you guys are doing and keeping us safe in your way. So thank you so much. We want to recognize our top 3 individual fundraisers for the DC Walk right now. So we talked about the teams, and now we have some really remarkable folks who have been raising great money. And in 3rd place is individual Courtney Watson, who has raised $9,055 to date. Can we all get a little round of applause for Courtney?
Woo! Courtney, yeah.
Woo!
In 2nd place, we have Harry Johnson, who we've had come on before, but he has raised over $10,000. So can we give a shout out to Harry Johnson? Everything you've done. Thank you so much, Harry.
I did.
And our top 2020 individual fundraiser so far is coming in at an astounding $22,700, and that's Molly Johnson. Molly Johnson, thank you so much.
Woo! Molly! Molly! Thank you.
Yay.
Unbelievable. You guys are absolute rock stars, and we really are grateful for you leading the way here. So thank you so much. By the way, that means you all have to walk extra far because you've raised so much money. So thank you for that commitment. We do have a couple other contests coming up. As I mentioned, we are going to be running this virtual walk for 30 days to give everybody a time to do it in a way that works for them. So we do have an exciting fundraising contest coming over the next 4 weeks. Stay tuned to your email. We won't blast too many at you, but we will have a couple throughout the next 4 weeks to take a look at that. And then we do have some upcoming fundraising challenges that include prizes from organizations that have donated to us for experiences, including Port City Brewing, Devil's Back Brewery, the Sheraton Downtown Denver, MGM Resorts Las Vegas, Barrel Oak Winery, Kendra Scott, Washington Wizards, Woolly Mammoth Theater, and more. So if any of those sound interesting to you, be sure to keep on the lookout for your email. Those will be coming to you soon. And while I had everybody, again, I've got access to these great people, and I want to use them to convey the expertise that they have. So you heard from Tony and Laura, and I wanted to bring in Dr. Jackie French. Dr. French is an epileptologist extraordinaire. She is our Chief Medical Information Officer, as well as providing epileptology at NYU. And I'll let you give all of that. You have so many titles, I can't even begin to go. But I really have 2 questions for you, Jackie, because Jackie's been working with the CDC and with other groups on COVID-19, because that's the hot topic. So I really like for you to just give a quick, elevator pitch on how epilepsy is impacted by COVID-19. And then talk about any of the latest guidance that you've heard from CDC. I know you have a little insider scoop there for us, so we would love to hear that, and I think would benefit from your knowledge. Jackie.
Hi from Philadelphia. You can see my background. So I want to let you in on some things that I've heard, because every week I am on a call representing the Epilepsy Foundation on a CDC call. And one of the things that I think everybody has been very stressed out about is that early on the CDC listed epilepsy as one of the conditions that could increase your chances of ending up in the hospital with COVID-19 if you get it. And I'm happy to say that if epilepsy is your only problem, that there is no evidence, absolutely no evidence, that epilepsy alone increases the risk of COVID-19 being a serious condition for you. If there are other things going on in the background, other diseases, if there's some lung problems, yes, that might be an issue, but epilepsy alone is not an issue in terms of the seriousness of COVID-19. And of course, we all have the same risk of getting COVID-19. We all want to avoid getting it. The best way to avoid getting it is to make sure that when you go outside and you touch any surfaces, before you touch your mouth or your nose, you wash your hands, wash your hands, wash your hands. And best way to keep your hands away from your mouth and your nose is to wear a mask when you go outside. And now the recommendation is that when you go outside, everybody wear a mask. I was at the supermarket this morning, I was wearing a mask, and so was everybody else. The most up-to-date information, Patty Schaefer, myself, and some other people are really trying very hard to keep everybody up to date in what's happening with epilepsy and COVID-19. On the website, epilepsy.com, we have a special section for COVID-19. So I highly recommend that everybody go there and take a look at the up-to-date information. And one last thing is that if you have seizures where you lose awareness, you might walk out of the house and not know what you're doing, or wander, or not know what you're touching, then you probably shouldn't be the one that's going out doing the grocery shopping or anything like that. So one way to keep yourself safe is, if that's an issue for you, just stay safe in the house. So I will give it back to you, Jeff. You said you had 2 questions, so I don't know if you have another one.
You got them. You wrapped them all into one, as you can so eloquently do. So thank you, Jackie. And you can hear more from Jackie if you want to check out our YouTube page, Epilepsy Foundation of America, or if you want to check out our Facebook Lives. It's almost like we're running a Big Brother show with Jackie. She's on so many Facebook Lives with us, but they're really great information. They're current, so I do encourage you to check those out. And as you can see from the chat, there's a lot of great resources out there, but specifically I'll highlight our COVID-19 page on epilepsy.com. It's epilepsy.com/COVID-19. And that will give you a lot of frequently asked questions, what we're hearing most about, what's important. We have Jackie, our physician advisory board. We have our other staff members and advisors that are actually helping build that page out and keep it current almost every day, every other day. So really great resource for folks. And then if it's not there, call us, email us, hit us up on social media. We'll make sure we find that information that you need, because we're here from you. So as we transition here, we've got a couple more minutes, and I want to thank our nationwide signature sponsor, EASI. I was trying to go for this 1950s product placement thing, very natural and smooth, but with what I have. But EASI has been a supporter of our walks across the country. They have been a long time supporter of the Epilepsy Foundation, and again, we couldn't do it, and they actually came in and raised their hand in light of COVID-19 pandemic to say, you know what, we need to increase our support and drive whatever we can towards you guys. So thank you, Team EASI. We really appreciate it. Can we give a round of applause for them? Thank you.
Go ASI!
Go ASI! Yay!
All right. Now, we're going to announce, we are going to announce the iPad winners. This was a random selection from people that have joined the call. You didn't have to really do anything to get this except listen to all of us talk for 30 minutes. And I've got it here. Somebody has randomly picked it from the hat, and that person is dramatic pause. Sarah Dillard from Ella's Epilepsy Avengers. Congratulations, Sarah. We'll be connected. There you are. Hello. Yes, iPad coming your way. Yay.
Thank you.
Thank you, Ella.
Go.
My understanding, Sarah, is Ella has been battling epilepsy since she's 11 and does have a rare form of epilepsy. Can you give us a 30-second hit on that? Hi, is that Ella?
This is Ella. She has had epilepsy since she was 3, and we have struggled trying to find some normalcy and medicines that work, and finally found out she was diagnosed with ESES. So basically, while she is peacefully sleeping, her brain is seizing like crazy. So we now get IVIG treatments up at Duke University Hospital, and she is doing really great right now.
Wonderful. Ella, how are you going to walk? What are you going to do?
Well, we're going to kind of social distance with our family and just go around our neighborhood and walk.
That's smart. We're going to put you on a PSA all over CNN. I appreciate that. All right. Well, thank you guys, and we'll be connecting with you offline to get you that prize. So thanks for joining us today and for all of the work that you guys are doing. And we wish you the best of luck. And however we can help, we will.
Thank you so much.
All right. All right. So going forward here, we want to, we do, this is not just, a couple folks doing some work. We want to also show our love to our amazing sponsors who have focused their events in Washington, D.C. We have some local sponsors really connected to the D.C. area or have driven their support. Of course, we have our nationwide sponsors with Greenwich Biosciences, EASI, UCB, LivaNova, who we've spoken about. Thank you so much again for everything that you've done. We also have our local sponsors, which have been a tremendous support for us. Most of these are longtime supporters of the organization, including NeuroPace, Supernus, SK Life Sciences, and the Danny Did Foundation. As well as community support from Synovian. We want to thank each and every one of you. Again, we can't do this without you. You play such a critical part, not only in our foundation, but also delivering therapies and support to our community who frankly needs it. So we really appreciate that. Let's see here, just make sure I'm on track. Great. We asked you why you walked earlier this year. You've been submitting Facebook pictures, and we want to thank those individuals who have shared those Facebook pictures and those stories. You guys rock. But now it's time to get back into your community. Go for a walk, raise awareness, talk to somebody about epilepsy. And before you leave today, just a few quick reminders. The individual that raises the most money starting today, April 18th through May 18th, will receive our second iPad. We had 2 that we were donated. We want to make sure that we get both of those out the door. Sarah got our first one, and our second one is going to be coming to that person that raises the most money from today, April 18th to May 18th. When you do walk, dress in purple, take a photo, tag us on Facebook or other social medias, send us an email, take a video. We want to see how you guys are walking. The more creative, the better. And we hope you guys all do it in a safe coronavirus way, coronavirus-free way. So do include us on Facebook, Instagram, and Twitter. Use the hashtags Walk to End Epilepsy and Virtual Walk to End Epilepsy. We do have a Facebook frame. You can update your profile picture following the steps, and you can help us raise awareness as well. If you do have a check, by the way, a little housekeeping item, you can check our website for instructions. You can send it to us at our headquarters. We'll make sure it gets processed. Or any questions, reach out to Andrew Edwards and our walkinfo@efa.org. I do want to say as well that a big part of what we do is seizure safety, and we've been working with the CDC and in partnership with UCB on our walktoendepilepsy.org/UCB to gather information and to provide resources on seizure safety. So we put it up here as an example of here are great easy steps to be safe. Stay safe side. 3 steps that you can remember to go share and teach and tell everybody. You know, you might want to tell them from 6 feet away in the grocery store, but go ahead and tell them. We want to make sure that this information is getting out there so that it really can save lives. It's really important. And frankly, what we want for seizure first aid is the exact same thing that you can see for CPR and first aid, right? We see that across the country. People are getting certified and doing it, whether it's hands only or what have you. We want this to be just as prevalent. So help us there, and we really appreciate all of your support with that. Before we sign off, I want to just introduce our DC Metro Executive Director, Jessica Deering. For those who are in the DC Metro area, you know, I think there's a big contingent of you here. We wanted to make sure Jessica had a chance to say hello. She is our wonderful Executive Director, point of contact if you have any questions locally. So Jessica, can you jump on, say hi, and let them know how to contact you?
Hi, everyone. Thanks so much for being here today. We really appreciate your support of our mission. The Metro DC chapter offers a variety of programs and services in the local community that we hope you have already or will participate in the future. We provide seizure first aid training for school personnel, law enforcement, businesses, and the broader community. We provide education programs like our annual Epilepsy and Wellness Conference. We have 2 virtual events coming up that you might want to join. One on April 30th is a webinar on tips to prepare for a telemedicine appointment, and then another webinar on May 21st on health for women and girls with epilepsy. To get additional details on the webinars, check our website at epilepsywdc.org. We offer support resources for adults, children, and caregivers, including opportunities to meet others, share personal experiences, and build friendships for all ages through support groups, special events, and programs like Kids Crew. We advocate locally on behalf of individuals and families affected by epilepsy, and we're working to build our network of DC-based advocates and engage young advocates through the Teen Speak Up program. To learn more about our programs and services we offer in the community, visit our website at epilepsywdc.org, give us a call, or follow us on social media. And I think there's a slide with everything that tells how to reach us. We hope we can meet you soon, really soon. Thank you.
Thank you, Jessica. We really appreciate all the work that you're doing in the community and supporting. Do not hesitate to reach out to her. I might even give you her cell phone number. We'll see. We'll figure that out. But anyway, we'll definitely make sure that we have that and that goes out in an email as well. So thank you all. Again, I want to thank our sponsors, Greenwich Biosciences, EASI, LivaNova, UCB, NeuroPace, Supernus, SK Life Sciences, Danny Did Foundation, and Synovian. You guys have been tremendous supporters. We can't thank you enough. We know these are hard times for everybody. You all have stepped up and have supported us, and we can't, I mean, we really, you have no idea. We really appreciate it. Everybody, thank you for joining us today. I am inspired by all of this collective action and the fact that you are out there making your voices heard. We are stronger together. And the epilepsy community is strong because of your individual contributions and outreach. We need everybody to be talking about epilepsy, to be sharing our seizure safety and just messaging as a whole. So I want to thank everybody for participating in the event today. I want to thank you in advance for all the support and the walking and the social media posts that you're going to do over the next 30 days. Follow us on social media. Thank you. There's no other better way to end that than go out there and have a wonderful day. Thank you so much.
Thanks, Jeff. Great job.
Thank you. Good job.
Thank you, everyone, so much.
Downey.
Thank you.
Thanks, everyone.
Everyone.
下が調べられた家が。 Thanks, everyone. Bye.
目が緑ついてたから入らはったんだよ。
Usually 10 o'clock.
Hey, Ray.
That way I can spend my afternoon.
Probably